The Letby paradox, a crisis of institutional accountability. The burgeoning narrative surrounding Lucy Letby's actions exposes a fundamental failure within the UK's National Health Service and the legal frameworks designed to protect vulnerable patients. The escalating public fascination with the theory positing that hospital systems, rather than a single perpetrator, bear primary responsibility for the tragic deaths and severe injuries of infants at the Countess of Chester Hospital represents a deeply unsettling development within the investigation and subsequent public discourse.
Initial reports and subsequent media coverage have largely focused on Letby's individual culpability, neglecting a critical examination of systemic deficiencies that may have facilitated her repeated acts of violence. The current trajectory demands a shift in perspective, acknowledging the potential for institutional negligence to create an environment where such egregious acts can occur, significantly complicating the pursuit of justice and demanding a more comprehensive understanding of the factors contributing to this devastating case.
This situation underscores the urgent need for rigorous scrutiny of hospital protocols, oversight mechanisms, and the ethical responsibilities incumbent upon medical professionals and administrators within the NHS.
The shifting sands of blame, a maturing legal landscape. The Letby case highlights the evolving expectations surrounding accountability within complex healthcare systems and the potential for legal interpretations to reflect broader societal concerns. Historically, criminal prosecutions in cases involving multiple victims, particularly in healthcare settings, have often centered on identifying a single individual responsible for the entirety of the harm.
However, the Letby investigation, fueled by extensive public and media attention, has introduced a crucial element: the potential for systemic failures to contribute to the circumstances enabling Letby's actions. The legal team's strategy, focusing on the coordinated nature of the attacks and the deliberate concealment of evidence, increasingly points to a broader network of culpability, encompassing potentially inadequate monitoring systems, insufficient training for staff, and a lack of robust mechanisms for identifying and addressing concerning behaviour.
This trend necessitates a reevaluation of mens rea, the mental element required for a criminal conviction, to account for the possibility of shared responsibility within a complex organisational structure, a shift that could have significant ramifications for future investigations involving similar cases. The implications extend beyond criminal law, impacting the legal and ethical obligations of healthcare providers and institutions.
Deconstructing the network, a multi-layered analysis of hospital systems. The evidence suggests a sophisticated, coordinated effort implicating not just Letby but potentially a deeply flawed operational ecosystem within the Countess of Chester Hospital. The core of the argument that Letby operated within a system susceptible to exploitation rests on a confluence of factors.
Forensic analysis of the hospital's electronic records reveals a pattern of delayed responses to concerning observations, a reliance on subjective assessments, and a demonstrable lack of effective interprofessional communication. Furthermore, the presence of multiple junior doctors and nurses, often working under pressure and with limited oversight, created vulnerabilities that Letby expertly exploited.
Crucially, the investigation has unearthed evidence of a failure to adequately scrutinise Letby's competence and her interactions with the infants, demonstrating a significant breach of established protocols and a critical oversight by senior medical staff. This suggests a systemic issue, a breakdown in the expected chain of responsibility compounded by a lack of proactive risk management, ultimately contributing to the tragic outcome.
The legal team is now leveraging this multi-layered evidence to construct a compelling case for institutional negligence, arguing that the hospital's failures created the conditions for Letby's crimes to flourish.
The long shadow of Letby, institutional reform and future risk. The Letby case represents a watershed moment for the NHS, demanding immediate and sustained reform to safeguard vulnerable patients and prevent similar tragedies. Despite the potential for a successful prosecution of Letby, the enduring narrative surrounding the case necessitates a broader examination of systemic vulnerabilities within the NHS.
The immediate consequences will likely involve significant changes to hospital protocols, including enhanced training for staff on identifying and responding to concerning behaviours, strengthened oversight mechanisms, and a greater emphasis on patient safety culture. However, the long-term implications extend far beyond procedural adjustments. The case has exposed a deep-seated lack of trust in the healthcare system, particularly among families affected by infant loss.
Addressing this erosion of trust will require a concerted effort to demonstrate accountability, transparency, and a genuine commitment to patient well-being. Furthermore, the investigation's findings will undoubtedly fuel calls for greater legal scrutiny of hospital practices and a re-evaluation of the legal framework surrounding medical malpractice claims, ultimately shaping the future of healthcare governance and patient protection within the United Kingdom.